Good morning and welcome to Glaucoma on Radio, right here on Solid 100.9 FM Enugu State, which is your trusted companion for information that protects life, health, and hope. Today's edition is brought to you in collaboration with the Eye Specialist Hospital Enugu, and we are focusing on a very important but often overlooked part of the eye care, which is life after vision loss. Life after vision loss. My name is Chibika James, and this is the Glaucoma special edition of the Viewpoint the Conversation, and you know it happens every Fridays from 9 till 10 a.m. Glaucoma is known as the silent thief of sight. For many people, diagnosis comes late, and while treatment can slow progression, some degree of vision loss may already have occurred. The big question becomes, what next? That is why today's topic is rehabilitation and low vision aids, helping people not just to see, but to live well, function independently, and remain productive despite visual challenges. To guide us through this conversation, we are joined by an eye care professional with deep experience in glaucoma management and patients rehabilitation. She is no other person than Dr. Suhanya Okeke. Good morning, ma'am, and good to have you.
Good morning, and good morning, our dear audience.
Right, thank you, Doctor, for joining us right here on Solid 100.9 FM. Okay, let's start with the basics, okay, because I'm sure there are some persons who might be listening for the first time. It's the festive period and people are probably coming home, to spend time with family and loved ones. Let's just give everyone what glaucoma is all about, ma'am.
Okay, quickly, a recap on glaucoma.
Yeah.
Glaucoma is a disease of the eye that causes blindness, and the most important component of this blindness is that if you get blind from glaucoma, you cannot reverse it. So for some reason you have a challenge called glaucoma, just know it is an irreversible cause of blindness. But early detection, if you can detect it early, you can prevent blindness. It's highly possible. You can stay sighted. So if you come and find that your family has a history of blindness or glaucoma, don't ignore it, because mama was too old. That's why she was blind when she died. Or somebody somewhere, it is 3 generations away, it is not in my immediate lineage. That is why you shouldn't see your doctor. If you have such things, you are at a high risk of having this kind of challenge. So always bring out some time, go and see your eye doctors so that they look into your eye and tell you the true state of your eye health. From there, we take it up.
All right. And today, yes, having established what glaucoma is all about, today we are not just going to be diving so much on it, but we are going to be talking about life after vision is lost. Now, Doc said that glaucoma is the silent thief of sight, and it's the cause of irreversible blindness. Now, once you get to that point, the sight is gone, but then you're still a human being, you're still alive, you're still living. So how do you live with it after vision is lost? Well, Doc, when people hear glaucoma, okay, they often think of only blindness. All right. At one point, should rehabilitation become part of the conversation for a glaucoma patient?
Good question. Now, before we reach the end stage, which is loss of vision, so many things do really happen. You can come to the eye clinic and you are asked to read the chart, which is a very basic examination, and at some point you are corrected or you read with confidence. At some point you are unable to read that chart. But that is if you can't use your eye to get to see the chart, it is still not a sin. That does not mean all your sight is gone.
Yeah.
That is why we are here today, okay, to talk about low vision. Low vision is not equal to no vision. Low is not no vision. It simply means there is some vision,
but it's low,
that is remaining. And this vision can be very useful. The only difference at this time is this vision, for some reason, cannot be corrected with the glasses. Like many of the patients, when they come, everybody wants to wear a glass. The common opinion is that if you wear an eyeglass, I will begin to see better. So when you say no, your eye is not okay for eyeglass, they can't really understand why they shouldn't use the eyeglass. But for some, you have reached a stage at that point, eye drops or a surgery or an eyeglass cannot correct or improve your eyesight any further. Okay, so it is like there is a problem, you can't improve from there, but you know within you that there is some vision remaining. And this vision is what is driving you to do few things at home. Wake up in the morning, do your activities, and navigate, go out, come back. But you are not seeing as good as somebody who is seeing with glasses, but you know something is remaining. This is what you call the low vision. There is some residual vision, leftover vision in your eye, but which can be useful to carry on with your daily activities. It might not be very good for you to take your car and start driving because you can crash with it. So there are certain things that can happen with that level of vision that is with you. So it is in as much as we say eyeglass cannot correct, is there anything we can do to enhance that vision such that you live a near normal life? Okay, it's like when you are talking rehabilitation. Rehabilitation means if any of your function is lost as a result of a sickness or a trauma. Trauma means accidents or of any condition. You have lost some part of life.
Correct.
Like, for instance, let's go to the leg, for instance. You had an accident. Your leg was amputated. Amputation means you lost one of your leg. You can no longer use that leg. But with the help of things called prosthesis, prosthesis are devices that look exactly like the leg, but you now put it on the leg, arrange it in, and teach you how to use that artificial leg to walk. So this time around, that artificial leg is not the real thing that is making you to walk, but the thing is, there is a way, it is a coordinated way of training the brain and the leg to work. But this time around, in terms of eye, you cannot put an artificial eye, and then you are going to train the
to let you to see.
train the artificial eye. It doesn't happen that way. You now want to assess those that have residual functional vision, those that have low vision, and see how best can we enhance this vision in them so that they can live a near normal life. You wake up in the morning, you are not calling, come here, do this one for me, do that for me, bring my phone, call this person. Can this work be done by yourself? How much can you help this person so that he or she lives an independent life? Not that we are going to call Mr. A and B, or your son and daughter or your grandchild, to stay by your side all the time because mama or papa cannot stand up and do something. Now, you yourself can do something because there is some residual vision.
Okay.
We'll come to those.
Yeah. Before we go to the rehabilitation, okay,
yes.
There's something I really want to ask. You talk about this low vision. You're saying that it's not that it is no vision at all, but then it's low. But how is it different from complete blindness, since there is nothing that can be done at that stage?
No, don't say it cannot be done. We'll come to it. It is a whole world on its own.
Okay.
There are two broad spectrum. You have low vision.
Okay.
Low vision in itself have different degrees. Some are called the very severe one, in which case everywhere might look very dark. They can't see much, only a little. Maybe they are seeing very close to the face or hand movement. Okay, then there are other people whose vision is up to, they can only read like 4 lines in the chart. Maybe there is what you call the central visual field. We also check how much vision you have by the side, and these are the factors that determine the severity of the vision loss. So when you say you have low vision, means there is still some functional or useful vision that can range from mild, moderate to severe, that is still left in you. So at the different degrees, you have things that are out there that can enhance your vision such that you can continue with your near normal life. Okay, severe vision loss might have more challenges than those that will have low of the low grade. Then in terms of what you ask for those that have lost vision completely, yes, they also have their own spectrum of rehabilitation, and there are a lot of aids within the technologically developed days of today. A lot are there. Okay, but I think we are talking about low vision and rehabilitation today. That is the focus for today. We will still talk about blindness and rehabilitation.
All right.
Okay.
All right. Now let's now dive into the rehabilitation process. Okay, because it's not a one-day thing. Many people assume that once vision is lost, that there is nothing that can be done. But what does vision rehabilitation really? Because rehabilitation differs. Okay, you give an example of the leg. Okay, that the own is for the leg. But when it comes to vision rehabilitation, what does it really involve?
Okay, vision rehabilitation, first of all, involves the patient and you, the doctor, sitting down to discuss. The doctor himself, when the patient comes, assesses how he comes in. He tells the doctor what level or what stage of this visual impairment are we working with in this patient, and he runs some tests for you. This time around, it may not be the traditional chart. It might be other charts. He now looks at what is his distant vision, what is his near vision. And apart from doing the test, you are going to have a lot of one-on-one discussion with the patient and know what are the vision is going down. What are the peculiar challenges you are facing? Is it that you cannot navigate by yourself to do your daily task, or is it that you wake up in the morning, you can't see your phone screen, or somebody is calling, you cannot identify who is calling, you want to respond to messages, you can't type in the text? Or is it that you want to go to your shop or office where you want to be, and what are these challenges, or if you are a lady or man, are you living alone? How best are you coping in your circumstance? Then are you able to cook? Are you able to go to the toilet? Or if you have to eat your food, does somebody have to bring the food and give it to you, and you still don't know how the food, or if you are pouring water on a glass, is the water being spilled over? So you are trying to, there is vision loss, but is there any way we can adjust this vision loss in a way that with the little remaining useful vision, can we try as much as possible to cope with daily activities? It may not be as good as somebody whose vision is full, but it might be very good, such that you might not be restricted to the bed or your room and start crying over, I can't do any of your or any of my activities. So we are trying to help such that you can do things by yourself. When you do things by yourself, there is a sense of independence around you. And if you want to go to the bank and you can sign the document by yourself, you feel satisfied, you have a value to your life, right? But when you cannot do this, you are more concerned. You are not sure whether the next person available is a trusted person or not. So a lot of trouble. You have a life filled with confusion. So you want to guide them through this different process so that things can be easy for you in the stage in which you find yourself.
Interesting. And just as they have different levels of glaucoma and how the eye operates, who can we say qualifies for low vision rehabilitation? Is it only for those who have advanced glaucoma, or people who have not too advanced glaucoma?
Beautiful question. Low vision is not only all about glaucoma or advanced glaucoma. There are conditions in the eye that may warrant that has led you to the point in which there will not be any more correction with your eyeglasses or any more correction with the treatment. Sometimes you hear the doctor, the glasses are not helping, you need some other things. Okay, so it can come in terms of glaucoma in its advanced stage. It can come when you have what you call age-related macular degeneration, which is an aging problem. Then you also have diabetic maculopathy, diabetic retinopathy. These are eye challenges following diabetes, but this time around it involves the macula or the retina in the eye, and such that there is a lot of damages that has taken place. Sometimes you also see patients who have passed through previous surgeries and the surgeries have failed, or they have gone into complications and they cannot be corrected. Or sometimes you have a retinal pathology or you have a retinal detachment, reattachment surgery, but you can't see maximally, spectacle no longer correcting. So it is more like an end game of visual treatment. You have gone to take treatment and you see that the eye doctors have done their best, but you are now at the terminal stage. Your vision is no longer getting corrected. That is the maximum vision with whatever treatment that you are having. So the next phase is the residual vision, which is the low vision we are working with. So if at the end of all disease process you have come to the stage of low vision, we now have to enhance the vision. This is the stage before the real phase of blindness. Okay, sometimes you stay in low vision for a very long time. Sometimes some people even know that they have some vision, residual vision still in existence, so they don't even know they can still be helped. So these are different phases.
Very good. And to be honest, I'm sure our listeners will be saying we have been talking about low vision aid, and all of that. Let's not really talk about the low vision aids. Okay, what are low vision aids, and can you give us examples of the commonly used ones?
Yes, low vision aids is is a vast spectrum.
Wow.
Okay, most of the time it starts with still glasses. You want the maximum correction to be given with the glasses. At that point, you now come, because whatever we are going to check, you must have the best corrected vision. With that, we now assess for low vision. When you have the low vision aids, the spectrum is broad. The beautiful thing is the spectrum is very vast. You have the optical aids. Optical means you can be helped with some form of lenses, okay, some magnifiers, some gadgets, prisms, some telescopes, the easily available one. Traditionally, you have the magnifiers. At least from the word go, you know what is a magnifier. Things that can enlarge something that you are seeing. These are the standard magnifying things. So the magnifiers comes in different sizes, and based on what we see, we can now enhance the magnification such that you can improve. But it all depends on the level of low vision you have. In the time of today, these magnifiers are also coming with inbuilt lighting. In the years past, the lighting was not there. So this is an enhanced addition to what it was before. So it improves the vision for you. You can actually keep it on top of the text you want to read or the label you want to read. If you are reading the drug, somebody has a card of paracetamol or antihypertensive, you want to see what is written, you check it and read. Okay, these are the cheaper standard magnifiers. It comes in different powers. Then there is more modifiable ones that can be worn on the neck. Some are worn on the eyeglass itself. There are ones that you can keep it on the table, that it has even stands. They are affordable and accessible, easy to use. They are all available. Things are changing, things are available. Then you have the non-optical aids. Then the non-optical aids may not be something. The beautiful thing about the non-optical aids, they are not very expensive, but they are available. Now, this one can take the form of lightening your environment. You see, the major challenge is when your vision goes down, everywhere looks dark. In the case of glaucoma, the side vision goes down. In the case of retinitis pigmentosa or night blindness, your peripheral vision shrinks. So everywhere looks very dark, and because it looks dark, it is nearly impossible for the patient to navigate through places. So we encourage in bright light setting in the home or where the patient individual is living. The other things you can do is to have contrast enhancement. Sometime when you have low vision, your eye may not be able to see everything, but if you have sharp contrast, eye still has the potential to detect between a dark black and white or dark black and yellow backgrounds. So you enhance some of this environment based on what is your vision looking like. For instance, you can use large print books instead of using prints that have tiny letters, you can use large printed material for your vision. For instance, you have an elderly person who is visually impaired, and he wants to see what you can print out those drugs names boldly and stick it somewhere so that he sees what he is taking. These things are all possible. Or if you want to put a signature, you have what you call signature guides. So this is very useful because everybody is concerned when you are going to the bank where to put the signature. Am I putting it in the right place? Am I missing it out? So the signature guide, it is tactile. Tactile means you feel it, okay, where the opening is. You now put your hand and you write it down. So it is very useful. And there are some underlining tools also, so that what you are reading keeps underlining. So these are some example of the non-optical aids. Then the other broad and vast spectrum is the electronic devices.
I was about coming to that because we are in a modern age, so technologies.
Yes, technology is a leap. Whether we accept it or not, it has come, and it has come to stay with us, and it is in every facet of life. It gives meaning to every individual. And good enough, our telephones itself are very useful devices. Many of us don't even know our telephones can be converted to simple magnifiers, and they can make the prints to very bold. They can increase the font size, that is the letter size. It has the contrast enhancement. It also has talkback facilities. Or if you are using the Android system, it has the talkback. If you are using the iPhone, you have the voiceovers. So it has this voice to speech function, speech to voice text. These things are all available right on our phones, except that those that are sighted did not have a need to use it, so you may not be using such facilities. So all these things are right with us within our phones, only that you need to be groomed how to use that, so that you use it for your own benefit. Then there are a lot of electronic magnifiers. These electronic magnifiers are so beautiful. Unlike the handheld magnifiers, when they say it is ×3, ×4, ×5, it is restricted to certain magnification only. But in the electronic magnifier system, it is automatic. You can actually have the provision of zoom. We all know what is zoom. You can increase the size, and the zoom runs from ×3 to ×2 to ×60 straight on. So and it has the added advantage of a contrast adaptation in it, and there are more features added to it. You can also link these electronic magnifiers to your phones, to your computers. You can send it to your TV screen also. So the biggest challenge with using a phone is that the phone has a standard size. The size is the phone screen, we all know, is small, and nobody wants to carry a large thing and walk around. But this time around, the gadget is just small. But if you link it to a TV screen, for instance, TV screens can range from 16 inches to these days TVs come even up to 70 inches or much more. So it is possible to increase. So that makes it easy for the individual to read his books, do a lot of activities. Especially, it can be very useful for workers. It can be useful for students, and so that those who are trying to, at the early to moderate stage, they will benefit more from using electronic magnifiers. There is also these CCTVs. We know how the CCTVs generally work, and now the CCTV also, the advantage is that it is a continuous, it takes the continuous record of whatever you are reading, seeing, and it keeps magnifying. So you might need the help of a computer or a TV screen still to send in the information. Then there are other things that are coming. Even the mouse you are using, you keep the mouse on top of the reading material, and the mouse now picks up everything and puts it in the screen, so it is easy. And good enough, they also appreciate that it is not only for those you can see, it also comes with voiceovers, so that whatever you are seeing can be read, because that is a challenge. Sometimes with the low vision, the challenge might be that you can't read a cluster of letters together. It becomes a challenge to pull all of them and read together. So whatever they can, these voiceovers, they help you to read at the pace you want. Some are fast, and some have the capacity to understand things fast. Some are slow to grasp. So you can actually have control over all of them. So it is possible to use them. Then you also have the provision of freezing what you want to, when you are reading, this is the page you are interested in. So you want to go back to it, and to go back to it, all these devices have a mode to freeze what you want and save it. Then you can go back to it and go through it once again. So it has a lot of functions. So things are not really looking dark. A lot of facilities are there. Then you also have so many other gadgets that are coming. These are the high ends now. The high ends are so many. Okay, I think before we go to the high ends, there are also gadgets you can use. Even in the phone, you have the Google Lens, which can help you see what you want to see. It even helps you to translate and talk over to you. So I think we should first use what is easily available, so that when we are going to the high end, you don't get thrown off balance, because it may not be available, it may not be accessible, and all that. So a lot of things are there, so we can take advantage, and then a little supportive assistance from your family members, because in terms of low vision and rehabilitation, your support network still matters a lot, because you are teaching the patient how to use all these gadgets to live a near normal life. But because he is challenged, he might have needs some time to grasp what we are saying, because he does not have the privilege of a normal vision. So family members who are with him, or family or friends, can help to understand, keep assisting until he pulls through with it. Then it will be good for the family, the friend, and the individual himself. Then when it comes to the high end, you have all these high technology, Google glasses. You have glasses, smart glasses are coming from different manufacturers. So those glasses have a lot of built-in memories, and these built-in memories can be in form of images, in form of text, in form of PDFs and all that, and it is linked to your phone. And then it can relate to you. That is the most important part in the audio way.
Very most important part. Well, ladies and gentlemen, we'll still continue having this discussion, and also we would also open up the phone lines for you to call and ask your question. And if you're just joining right about now, we are discussing life after vision loss. Okay, the rehabilitation and the low vision aids. That is what we are talking about. Alright, welcome back. It is still the Glaucoma special right here on Solid 100.9 FM, and you are in company with Chibika James and Dr. Suhaya Okeke, and we are talking rehabilitation and vision, low vision aids. Rehabilitation and low vision aids, and we are also discussing about life after vision is lost. We have been able to talk about what glaucoma is all about, talked about the fact that yes, at what point should rehabilitation become a part of the conversation when having a glaucoma patient, and what exactly do we mean by low vision and how it is different from complete blindness. With Doc, we went further in understanding the rehabilitation process, who qualifies for low vision rehabilitation, and many people who assume that once vision is lost, nothing can be done. What does vision rehabilitation really involve? And we also talk about the low vision aids, and we talked about what are low vision aids, and Doc gave us example of the common ones used, and we also talk about the optical device like magnifiers, and as well as the advanced ones that we have. Well, let's get to hear from you as well while we continue having this discussion. The numbers to call to be part of the program, to ask your question, and if you've got contributions or submissions, you can feel free to reach out to us. The numbers to call are 0704 550 2840, 0909 771 1009, and you can also call 0902 311 1009. All right, let's go to the phone lines this morning. Hello, good morning to you and welcome.
Hello, good morning. My name is Joy, calling from my bank state.
Joy, good to have you.
Yeah, good morning to the doctor.
She can hear you. Go on.
My question is, what can I get them, because I have advanced glaucoma. I've lost my sight, but not that completely, meaning that not little to none. So I don't know how I can get through the doctor so that I can come direct to the hospital.
All right, Doc, you listen?
Yes. She should come to the hospital, because it is at the hospital we can actually assess you, the state of your visual impairment, and then we can see what can really be done to enhance your sight. So Joy, I think you should come to the hospital, okay?
All right, thank you. Let's to take more call. Hello.
Hello. Good morning, Chibika.
Yes, good morning, sir.
Please let me not disturb you so much. I want you to collect down your guest number so that I'll call her later and discuss more issue or where to see her. Because she played well. My own side, my side is so clear. So it's not something I'm talking on air.
All right.
It's something that I will collect her number and call her. That's where I go see her so that you know what is actually in my own problem. So to fight for it.
All right.
Thank you.
Thank you very much, Babu, too, who would like to, I don't know if I should answer this. Maybe you get to, come to the hospital, right? Yeah, so if there's any phone numbers, I would roll out the phone numbers for you to call later on before we wrap up the show, okay? 0704-550-2840, 0909 771 1009, and you can also call 0902 311 1009. Doc, let's talk about lifestyle and support before we wrap things up, because our lifestyle too as well, once all of this is discovered, is very important. So how important is the family and caregiver support? Because you mentioned something earlier saying that it's also important to have someone close, or like a family relative around when all of this things is going on. So how important is a family and caregiver support in the rehabilitation journey of a glaucoma patient?
the support of a family, friend, caregiver cannot just be overlooked when you are at the point of losing your sight, because if you are privileged to have your support network, it is easy to walk through this process. Because you also remember when you see the doctor, your time is somewhat limited. You don't have the entire day with the doctor to do all the needful. So the doctor teaches you something, you have 2-3 repeated visits to put you through. But then if the family is involved and the person comes around and learns it, you training and retraining, talking about it and all that, it helps the person to be at it very fast. And the earlier this person moves to understand the gadgets, the training, is easier for the family, because everybody wants to be independent. Even the person whose sight is going down wants to be independent. Even the relative will be happy that this my uncle, this my son, this my father can now do 1 or 2 things by himself. Even if I'm not in the house, his life is not difficult. Everybody is happy that I'm not looking, I'm not there, Papa is going to have it rough. That's not the feeling we all want to have. Oh, I'm not there, but Papa can take care of himself. That's beautiful. So we all have to apply ourselves to learn this. It's possible. Then you ask about lifestyle modification. It's important that lifestyle modification, let it begin in time. When it starts in time, things are more easier than at a certain stage. Okay, lifestyle modification start with what you eat, how you do exercise. Life means what you eat. Try as much as possible to have a lot of fruits and vegetables in your diet. Colored fruits, bright colored fruits, vegetable. Go for leafy greens. You go for red colored tomatoes, or you go for orange like carrot or pawpaw, mango. They are seasonal, highly seasonal. Things like ube that are purple color, they are very rich for your eye health. So just use these ones. Even though we have not groomed ourselves to eating such things, adapt it. They are very good. Then exercise is also a part of it. Train yourself for some exercise.
Very important. Train yourself for some exercise. Just before we go, just so you know, the eye specialist for Babotu was asking where can he meet with Doc. All you need to do is come to the eye specialist hospital at GRA Enugu, Nigeria, which is opposite former Adoration Ground, Christ the King Parish. Alright, opposite former Adoration Ground, Christ the King Parish, the eye specialist hospital, GRA Enugu. And if you want to reach out to the eye specialist hospital, all you need to do is call the number 0803 869 4985. I'll take it again, 0803 869 4985. One more time, 0803 869 4985. Doc, final words before we go?
Yes. On this stage, I just want to give every one of our listeners hope that low vision is no vision. If there is still a lot of things that can be done to enhance your vision, but with the little sight you have, with proper training, proper tools, we can enhance your life and your sight. You can still continue to enjoy what you used to do. And live your life normally, independently, more importantly, enjoy your life. So just do the needful and you will be happier. And for those who have lost their vision, we are coming today. There is a lot of things that can be done to reshape your life too.
All right, thank you very much. And that's the wrap on the show for this morning. Yes, the Glaucoma special would come again, same time, same station, 9 to 10 a.m. from on Friday. And yes, at the top of the hour, 10 a.m., it is going to be time for All Your Rights. Do have yourself a wonderful weekend. Bye-bye.
Tune in to Solid 9 FM. Fill a glass and maybe come.